All right, here we are again. Hope everybody's having a good day. I am Dr. Heather Moore, owner of Total Performance Physical Therapy. We are going to cover, is cracking your knuckles bad for you? So it's a question we get asked a lot. It's a question, or it's something I see done in here a lot, and it's something that needs addressed. Is cracking your knuckles bad for you? The answer is yes. Yes, it is. You do not want to forcibly crack your knuckles. You don't want to forcibly crack your neck or anything else in your body. But let's go over it. Let's just start with the knuckles before people weigh in on other body parts. So when you crack your knuckles, and your knuckles will naturally crack. So what happens is there will be a buildup of, there will be a buildup that needs to be released in your joints. And when that happens, you'll get a crack. That crack can feel really good. Crack can be not so good. Crack can, be neutral. Doesn't matter. But that natural crack is okay, and it's designed for your body to do that. Let it go. It's not a big deal. When you forcibly crack your knuckles, what happens is you wind up taking your joint to a point where the muscles and the ligaments are kind of stretched. And then what happens is you crack them. So when you do that, you wind up actually expanding some of the ligaments. Now, ligaments never go back to their original form. Muscles, yes, they can go back to a smaller length. But ligaments do not go back to their normal length. So that's why over time you may say that, oh, my knee is looser, or things are looser in my body because some of those ligaments may have expanded. If you're an athlete, you're going to notice that some of your joints are looser because you have really worked your body and you've expanded those ligaments. So what happens is you wind up making those ligaments bigger, and you wind up making them longer. And they're not, now this happens over time. I'm not saying if you crack your knuckles for 5 days, you're gonna wind up changing the composure of your ligament. That's not gonna happen. But most people who crack their knuckles do it forever. And when you do crack your knuckles and you wind up changing that ligament, that means that the joint in your hand, whether it's this joint, whether it's this joint, whatever you're cracking, that becomes a little looser too. So it's not as snug in the position that it's in. So as those ligaments become less useful and become stretched out over time, you wind up with a looser or more of a wiggle in your joint. So it's easier just to dislocate. It's easier to not be in the right position. You wind up really needing to actually crack your knuckles. And that's one of the reasons that it's so hard to break, is because your ligaments wind up stretched and then they fill up with things that need to be released, and they wind up actually almost like pestering you, saying, okay, you've got to release all of the toxins in your joint. You've got to release us. You've got to release us. And what happens is when you do, you get a rush of endorphins, there's mechanoreceptors, there's different things that come in to the joint to kind of give you a little reward, like, oh, you thank goodness, you released me. That's why it feels so much better, is there's actually a reaction in your joint that it's like, oh, all right, I need to keep doing this. Well, you need to retrain your body that when you feel like you have to crack something, that you don't. Because that will keep that stimulus, that reaction that happens, will keep you coming back for more and more and more and more until you have some arthritic hands, you have really loose joints that don't stay in place. All of those things can make your hands really sore. It can make it really hard to do fine motor activities, like writing, like holding a coffee cup, like tying a shoe, things that are just using your fingers with. So I understand that cracking your knuckles becomes a habit because of the reaction that happens in your knuckles, because of the feelings that you get, that relief, because the gases inside of that joint will build up and it will allow for that release, and it's like, but it's never going to stop. And as you keep continuing to crack, and it's a manipulation technique, as you do that, you're going to stretch those ligaments. As you stretch the ligaments, the joint doesn't fit together well anymore, and that leads to long-term problems, which affect your fine motor skills, like writing and things like that. So you have to do everything you can to not, when your body says, crack me, you need to not crack it, because it needs to learn to exist at where it is. And it will eventually, over time, not send signals to your brain to crack your knuckles if you slowly decrease how much you crack your knuckles. But it really is something that is not good for you. It's not good for your body. You need to be careful. You need to really make sure you're not doing this on a consistent basis. But everybody I know that cracks their knuckles cracks them 100 times a day. And that's why you wind up with these changes to the joint, because it is not designed to be forcefully manipulated as many times as that in a day. If you or someone you know is experiencing pain and wants a free consultation with a doctor of physical therapy, all you have to do is call our office at 215-997-9898, and we'd be happy to get you in. Thanks, and have a good night.